everyone, my name is Linnea Lampinen, and I am a student in the Clinical Psychology PhD program here at Rutgers, working with Dr. Vanessa Bal. My research focused on the Social Responsiveness Scale 2nd Edition, or the SRS-2, and the SRS-2 is commonly used, particularly in neuroscience research, as a screener for autism or to quantify levels of autistic features or autistic traits. Based on research that's been conducted in children, we know that the SRS isn't measuring autism per se, but rather it seems to be measuring some more general level of difficulty that might be associated with autism, but might also be associated with co-occurring conditions or things like language level and cognitive level. Building off of that work in children, our lab looked at the SRS-2 adult form in a sample of 203 autistic adults. We found that the SRS-2 was highly associated with scales designed to screen for internalizing, externalizing, and personality features. More specifically, individuals who met cutoffs on depressive, anxiety, ADHD, or avoidant personality scales were much more likely to meet cutoffs on the SRS-2. This is just a reminder that if you are someone who is doing autism research, you should be cautious when you're selecting your measures. Social difficulties are not specific to autism, and measures that are designed to capture features of autism might actually be capturing features of these co-occurring conditions, like depression and anxiety. If you are someone who is already using the SRS-2 in your research studies, you should just remember to consider these co-occurring conditions when you're interpreting the scores of the SRS-2. And then finally, if you're a neuroimager or anyone else who is interested in getting involved in autism research, but you're not sure exactly what measures to use, we have a whole team who would love to talk to you about it. So you are welcome to reach out to me at my email or to reach out to our lab at Lifespan Autism Lab here at Rutgers. Thank you so much.